experience your snow day. Welcome to the State of Homelessness and Hunger Bridging Policy and Practice with a focus on Staten Island today. So welcome, welcome. Welcome to our Staten Island session, to the inaugural Five Borough Tour from Housing Solutions of New York, which is the intersection of housing and human services. In this current panel for the State of Homelessness and Hunger, that's bridging policy as well as practice on the ground. That's going to be our focus specific to Staten Island. And our mission remains clear. We are committed to ending homelessness through collaboration, data-driven strategies, as well as community-centered solutions. This will not just be a presentation, it will be a collective conversation about how we can drive meaningful change. So let's talk what this panel is actually about. Today's virtual panel brings together advocates, system navigators, government partners, and on-the-ground practitioners. We'll discuss the realities New Yorkers are experiencing, from housing instability, food insecurity, specifically in Staten Island. Our goal is to share resources, elevate challenges, and identify actionable solutions that support individuals and families in crisis. This space will be a space for transparency, collaboration, and most importantly, a deeper understanding of the emerging gaps. Now, to do this, we need to understand the complexities of homelessness and hunger and how it's interconnected, the systemic issues that relate to it. So when we talk about homelessness and hunger, we're talking about the intersecting crises of economic instability, health disparities, systemic inequities, as well as generational impacts. This conversation allows our practitioners, our policymakers, as well as community members to learn from each other, as well as present resources that you all as a community may not be familiar with. And so what we want to do is highlight not just the challenges, but the opportunities. Where are the gaps? What's working? What's innovative that can be scaled? Together, we truly believe that we can uncover practical as well as community-led solutions. Now with that, let's look at the data a little bit. This is going to help ground the conversation. This is very specific to Staten Island. 5.7% of students are facing homelessness within Staten Island. And so this is 1 out of 18. Over 4,000 individuals in last year's Hope count were basically counted as experiencing unsheltered homelessness within Staten Island. Last but not least, 12.5% of residents have been facing food insecurity, and this is speaking to the data from 2025. I say this that even though Staten Island, compared to the other boroughs, is actually higher on the scale, we still want to speak to Staten Island as a whole. Too many times Staten Island is looked at as the forgotten borough or the one on the other side of the water. And so really to bring it to scale, to speak to the work that's being done, how do we, if not totally remove, mitigate that number of 5.7 specific to our students? How do we change that Hope count? The one that was recently rescheduled, my expectation, hope no pun intended, is that we go from 4,000 down to 2,000 down to 0, going back to our mission being, how do we end homelessness? And then lastly, really speaking to the residents of Staten Island. We already know some of the two really heaviest hit boroughs in poverty are Stapleton as well as North Shore. And we really want to elevate that space. And so I say that to say, when we look at the data doesn't just quantify need, it reinforces why our work remains critical. So just want to speak to the reality. The reality is that homelessness is driven by structural forces. This is economic inequality, lack of affordable housing, rising cost of living and re-entry challenges, domestic violence, and so much more. It's systemic, meaning no single individual action can fix or cause it. For families, it's a cycle of instability. It's not a momentary setback. And homelessness is not just a personal failure. It's a public crisis that requires coordinated response. And this frames and helps our focus on policy solutions, cross-agency collaboration, as well as community partnership. With that, to help lead the conversation and drive this further, I'd like to introduce our moderator of the day, Marley Warren. Marley, you can take it away.
Welcome, everyone. Thank you so much for joining us today for this important conversation on the state of hunger and homelessness in Staten Island. I would like to take a moment to introduce our panelists today. Our panelists represent what it looks like to have cross collaboration to support a community. We will start, I'm going to start in the order that I see on my screen. So I'm going to start with introducing HSNY CEO, CPO, excuse me, Chief Program Officer, Dr. Xellex Rivera. She is been our esteemed CPO leading us through housing. She comes with a wealth of experience in the counseling and impact sectors and advocacy for what the intersection of housing, homelessness, and human services looks like. Her wealth of experience is currently leading us as we look at what 360 wraparound services looks like at HSNY and how do we continue to work towards our mission to end homelessness, looking at all of the reasons why folks become homeless and all of those solutions. Um, Next up, we have from the JCC of Staten Island, Miss Paloma Wasserstein. Um, Paloma brings us a wealth of experience as well, and her lived experience as a Chilean immigrant has driven her work across social services. She currently is managing the food pantry's transition to digital format at the JCC, and expanding the reach and being able to streamline services for clients there, that making sure that all of their needs are met beyond just food insecurity. We have Nina Salerno next from Senator Jessica Scar. I'm going to say, slow down and say this again. Senator Jessica Scarcella-Spanton's office. She is going to speak with us around policies, how the state can help, and how residents can engage with the office. Um, Going in order, then we have Miss Heather Butts, co-founder of Health for Youth Inc. Um, Ms. Butts created a college readiness and preparation organization to help support more than 7,000 students achieve their dream of going to college. With this, it also addresses all of life's issues where there are intersections between homelessness and food insecurities. Her work has also led to turning little libraries into food pantries and bringing food gardens to communities where folks are in need of fresh food. Um, I'd also like to welcome today Mr. Alex Hughes, who comes to us from Project Hospitality, which is a nonprofit in Staten Island who is working towards housing the homeless and feeding the hungry. Um, this is a position in which we see a lot of collaboration across other community partners to ensure that folks who are facing SNAP benefit are using SNAP benefits and needing food assistance have a place to reach out, so that they can know where to come for services. Again, welcome to all of our panelists, and we really appreciate you being here today to speak about such an important issue. Um, with that, we will get into some questions. Everyone, take a sip of water, take a sip of tea, and get ready for a really engaging conversation around the landscape in Staten Island. Ms. Butts, I'm going to start off with you with our first question, and that is from a public health and policy perspective, how do homelessness and hunger show up as a health issue in communities like Staten Island, and why is it important to address them together rather than separately?
That's a great question. Can everybody hear me?
Yes.
Great. Okay. Yes. So, uh, in addition to my work at Health for Youth, I am an associate professor at Columbia University at the Mailman School of Public Health. So, a lot of the work that I do is around something that we call social determinants of health. And that sounds very sort of sophisticated. But really, what that means is it's all the bits that happen to you and make up your life that have an impact on how you show up, your built environment, what an impact that has on you. So, given my discipline, I'm a lawyer by training too, but given my discipline, I don't really separate out these social determinants. And those things are things like education and where you live and where you grew up and who your family is and so forth. Um, do you have supermarkets near you that are have healthy food, or are there places that don't have healthy food? So I don't really separate them out, and I would say that they're inextricably linked to the health and well-being of people. So when we think about people that are unhoused, when we think about people that don't have healthy food near them, when we think about people who have to travel long distances to get a decent education, that's what then leads to people having poorer health outcomes, which can lead to people being in crisis. And so, if we can deal with some of these social determinants long before someone's in crisis, then that can lead to healthier outcomes for people and healthier lives going forward. So they're absolutely linked. You can't separate them out, and it does determine people's overall health and well-being.
Thank you so much for that. That actually leads directly into our next question as we think about how many folks HSNY has dealt with in crisis. Um, Dr. Rivera, from HSNY's vantage point, what does the homelessness hunger landscape look like in Staten Island today? And how does it compare to what we're seeing across the city?
Currently, HSNY's footprint in Staten Island is small, but it is impactful. We currently have a semi-large facility in Staten Island, right on Jersey Street, where we are housing a little bit more than 25 individuals who are facing being unhoused, but they're also persons living with HIV and AIDS. We work collaboratively with our other programs in Staten Island, and we're looking to grow and expand with other CBOs, like our partners on the line today, so that we can try to make sure that people are getting most adequate and most comprehensive services. So our impact might be small, but HSNY's impact as a whole is very large and growing in New York City.
Thank you for that. As a follow up, can you tell us where the systems are working really well together and where they're misaligned?
Systems as far as community systems, or we're talking internal systems?
Both program systems and community systems.
So I think one of the things about Staten Island is people try to act like it doesn't exist, right? And I think sometimes we forget the fact that our fifth borough is still a connection of New York City. I think that this hidden gem of Staten Island is in dire need of resources and collaborative partnerships as a whole, which I think would strengthen all programs on the island, so that we all can kind of work together. Because the island isn't big, but it's also not small, right? So from a program standpoint, even though we're out there and there are a lot of other agencies and programs in Staten Island, I think if we started to work more collaboratively together, whether that's a food pantry from somebody to HSNY having more resources with being unhoused and being connected to New York City, I think working together is the main thing that I think happens, and just acknowledge that Staten Island is a real place.
Thank you so much for that. Um, Paloma, when individuals come to the JCC seeking help, what are the most common challenges they're facing, and where do people tend to get stuck between need and support?
Hi. Being in the food pantry, I realized a while ago that people looking for food, it's almost like a cannery and the coal mine, right? They come to get food because they are struggling with everything else. Food is the first thing that they can kind of control. The rent is set, they have to pay the rent or they will be evicted. If they have medical bills, they have to pay those medical bills or they won't be seen by their doctor. So they start cutting corners. First, it's all the non essential things, and then it's food. They start eating differently. They start eating not really the healthy things that they should be eating. They start buying less, and sometimes they go without unless they go to a pantry. And that's usually the first encounter they have with other benefits they could receive. For many of them, it's like the first time they hear, oh, so I could apply for SNAP, or I could see a social worker and get all of these other benefits. It's a little bit like a portal to everything else that they may find and receive if they qualify. But that's the tricky part. If they qualify, that's where we are struggling.
Yeah. I think that the restrictions and the barriers of entry can always be hard for people to navigate, especially when it's a time of need. I want to
Exactly.
open this next question up to everyone on the panel. And when we think about when you're meeting folks in crisis, and what that road to stabilization looks like, what do you think surprises people the most when they find out how hard stabilization can be?
I would say it's a frustration dealing with a system that is not client friendly. It takes a long time for them to get through somebody that can help, and waiting times are horrible.
I would agree with that. I think a lot of times people think it's very as simple as, oh, if someone's experiencing homelessness or if they're experiencing hunger, well, they can just go to this one place and they can get a job and that'll just solve everything. But I think that a lot of what our office does is we act as that middleman for a lot of city and state agencies because people struggle so much to get in touch with a real person who can hear them out, hear what their issue is, and point them in the right direction. So that's like a lot of what our office does is just that middleman aspect to be like, well, we need to hold our city and state agencies accountable in making sure that they're pointing people in the right direction and that they're not having them run in circles just to get an answer for something that might sound simple from the outside.
Yeah, I agree with that too. You know, for example, we're having a coat giveaway here today with New York Cares. 2 p.m., 120 Victory Boulevard. Come on down. um, but, you know, the interesting thing is, you know, that was a pretty straightforward, you know, event for us to pull together. Talk to New York Cares, get the codes, get the people here, the people come, they get their codes. But when you're dealing with larger systems at the federal or state level, and you know, Nina's more of an expert on it than any of us, that becomes a lot more sort of tortured for people in terms of even knowing who you need to talk to, where you need to go, you know, which elected officials do what. That might seem simple, but no, I talked to my city council member about this. Oh, that's not what they do. Oh, I talked to my state senator about that. That's not their job. So those are the kind of things that I think can make it very difficult because you know if you you know have a don't really sort of have the guidepost to let you know what who does what and um, you know who's responsible for what. It is very challenging for people, and it's not their fault.
Yeah, and to just go off of that, that's a huge part of what our office tries to be is that guidepost for people, because people will call us with an array of issues that a lot of times do have to do with homelessness and hunger and where to go and who to call and what organization does what. And I think our office tries and does successfully a lot to make sure that we are not only pointing people in the right direction, but we're also following up and holding those agencies accountable to be like, hey, we know that we sent you this information about our constituent. They need assistance with XYZ. Where are you on? Where are you at with this every week? Just checking in to make sure that things are going smoothly and that they're getting the assistance they need.
Thank you all. I know that that is something that we definitely see at HSNY as well. It's the follow up, making sure that the clients are getting what they need as they get referred out. We always want to find a way to keep folks tethered so that we can help them along their way because it's not, they didn't get, they didn't become homeless immediately. And so it's not going to become just an easy exit out for housing or food security. Um, I have another question, Nina. This one is for you and Alex. What are you seeing right now around food insecurity on Staten Island, and how does hunger intersect with housing instability for the people that you serve?
Alex, you want to go or you want me to take this first? Alrighty. Well, hunger and homelessness are very deeply connected issues, and we see that connection every day on Staten Island, from our seniors to our veterans to, as you mentioned earlier, there's 1 in 18 students who are experiencing homelessness and hunger on Staten Island alone. Our working families, they're struggling to stay afloat, and it's not something that can be fixed with one simple policy or one simple program. It's going to take a comprehensive approach that focuses on affordability, stability, and access to services. And that's something that our office tries to do every day, particularly with seniors who rely on SNAP benefits. When SNAP skimming was becoming a real issue, we were really working aggressively with the HRA to replace compromised cards and secure new benefits as quickly as possible. We're also working on that on the legislative level as well, fighting for things to be included in the budget. Last year, we had a really big win with universal free school meals, because that's going to like monumentally impact our students, and making sure that not only are they fed while they're in school, breakfast, lunch, but making sure that they can focus in school and not be afraid of, oh, well, I didn't eat a single thing today and I'm going to go home and have nothing. So I think that while even when the federal rule limits can be recovered, we want to make sure that there's nobody left behind with food, without food or support, and that's a lot of what our office is trying to do, especially with all the federal cuts.
Yeah, and on a similar note, we're seeing, just to put it quite simply, we're seeing more and more folks that are showing up to our pantry every single day, and it's not only that, but folks that need services other than food, and I think that's one of the main ways that the emergency food sector at least has changed, over the last 4 or 5 years, really ever since the sunsetting of COVID era additional funds and things like that. We've really had to, and I mean, this is a common story with pantry work, but do more with less, right? And it's like, and we're in that very moment right now. And to put it, we're seeing a drop off of support from the federal government in multiple ways, mainly policy-wise, that is leading to shortfalls that the state, that we're advocating that the state can make up for. I will say that fortunately we're in a place in New York where we have a lot of legislative support for anti-hunger programs and anti-poverty programs at the state level. And Nina mentioned the SNAP skimming. New York was actually the hardest hit state in the country. I think it's like 150,000 families have had their SNAP benefits skimmed, and as of right now, there's still no solution for that. And pantries don't, like, when we see an increase in funding for food, that doesn't necessarily we see an increase, for staff. So when I say do more with less, it literally means like do more with the same or oftentimes less. A lot of pantries are having to make really difficult decisions as far as, we've never had zip code restrictions, right? But like we're not enforcing that right now, but a lot of emergency food providers are strongly considering implementing zip code restrictions because the need is so great, and it's frankly not possible for any one organization to fulfill it on its own. So what we're really seeing is it takes a village policy-wise and organization-wise, and there are good things that are happening, like Staten Island, I believe, has one of the most successful 1115 Medicaid waiver programs currently in New York State. So it's called the Staten Island PPS, and there's still work to be done there, but that's another resource that's another example of organizations from so many different areas of expertise are coming together under one program to really try to lift folks out of poverty, and give them the tools to become self-sufficient and maintain that self-sufficiency, right? But it's very difficult in the environment that we're in. So the collaboration is all that much more important.
Um, I also just wanted to note too, going back to the housing aspect of it all, the senator is very, very she's very supportive of supportive housing. There's a lot of good models in the Brooklyn side of our district, in southern Brooklyn, where that combines safe, stable housing with on-site services. Places like Surf Vets that provides housing for formerly homeless veterans and also employs them. There's a bagel store downstairs. They all in one. They have a job, they have a house, they have somewhere to call home that they can feel stable to rebuild. And then we also have Raven Hall in Coney Island. That's our 77 apartments that are set aside for victims of domestic violence and their families who are experiencing homelessness. So again, these are not issues that are not intertwined. They're very intertwined, and I think that we need to be doing more to highlight that they're intertwined and also provide these supportive programs that can help bridge both gaps. And that's something that the senator is very, very supportive of expanding.
Thank you both for your very in depth answers. I actually want to spend a little bit more time and go a little bit deeper into talking about what's working and where the gaps are. And I want to open this up to all the panelists. As we're hearing about the policy changes and the restrictive natures and all of the things that are happening in this current climate that we're in, literally, we're in the middle of a freezing winter where, this is very hard for folks who are experiencing homelessness or even food insecurity to get to the food that they need access to when it's such inclement weather. So to all of the panelists, I want to find out, what are you seeing working, either personally at your organization or greater all in the collective collaboration, and where really are those gaps?
I guess I'll jump in here. I can speak for HSNY. One of the things that I am very big on in encouraging of both my staff and clients is, the first thing, I do believe that you have to pour into the staff that work at your agency. I think sometimes we forget that they exist as well. And so, because if you do not pour into your staff, then you're unable to pour into the clients. And if you can't pour into the clients, then the clients won't maximize success, because we already identified the levels of bureaucracy as well as intentionality in the system that is kind of creating some of these hurdles that people have to go over. So I think one of the things that works the best is treating people like human beings, giving them a line of respect, dignity, and integrity is always the best option. So like, it's not in Staten Island yet, but HSNY does have a no-line food pantry. We were intentional about the fact of having a no-line food pantry because we wanted to make sure that dignity can be put back in the point of trying to ask for food, right? It's already a little embarrassing, let's say, or can be embarrassing to have to stand in line and ask for food for your family. And so we try to be intentional about making sure, and that's not just with our food pantry, also with our food and nutrition program. Our food nutrition program is designed where people can come in with dignity, they can shop. It's actually a little baby supermarket. And so they're able to shop, but as simple as that might sound, excuse me, excuse me, as simple as that might sound, now I need water, Marley. As simple as that might sound, it's a big thing, right? People feel empowered after that point. And once a person feels empowered, then they're able to be more compliant. And I think what happens is we forget that, and we start off services by just giving rules and regulations instead of just talking to the person. The second part I want to add, that is very big for the staff and the programs here at HSNY, is that you meet people where they are and you ask them what they need. You'd be really surprised at the fact that, just because I ended up in a very bad situation, that doesn't mean I lost intellect, and it doesn't mean that I don't know what might work for me. And so one of the things that we also have to look at in social services is talking to adults like adults, sometimes to children and kids as well, right? But they can tell you what they think they need, and then if you disagree with it, then you can go ahead and meet in the middle. But the key part there is giving people that level of respect, I think would maximize levels of success.
Um, Dr. Rivera makes a very great point about meeting people where they're at, and that's certainly a cornerstone of our office. We run mobile offices not only in places like the local bowling alley. We're at Rabs every week, but we also have partnered with a lot of our food pantries on Staten Island to meet with. We've partnered with Project Hospitality. We've partnered with some smaller other local ones as well. I've personally been following food pantry trucks in the dead of summer, out with a table, getting my tan and discussing with people where they're at. Honestly, we try to be there because we know that not only are these people kind of just in and out of their day where they can only focus on what they can focus on. We know that so many people aren't thinking, oh, well, who can I call about this? They're just trying to get through their days. They're trying to get the food that they need for their families and they're trying to go home. So we're trying to meet people where they're at to say, hey, we know that you only have time today to stop here and we want to be here if you need anything. So that's a huge, huge cornerstone of what our office tries to accomplish as well.
Yeah, I agree with that. I think and sometimes we think people have needs and they might have those needs but in a different way. An example is I'm actually look so I'm at our pantry and market now and I'm looking at this uh quinoa we got. And I was like, I love quinoa. Yummy, yummy in your tummy, right? And so then we're like, trying to like give people the quinoa. People are like, I don't even know how to cook that. Like, what even is this? Like, what are you doing? So, I think, and that's a small example, but sometimes when we have a perception of what will work for us or what we like or we think is fabulous or great, it doesn't work for people. And then going back to social determinants of health, and can people get to it? Do they have the transportation to be able to get your quinoa? Do they have the ability to be able to are they so hungry that they can't even think about getting to food because they're so hungry? And I know that sounds circular, but that can be an impact for people. So I think the ability to um, give people what they want and need, um, I think that those two are they're imperative. And then I think the only other thing is sort of being very intentional about our advocacy on Staten Island. I saw an Instagram post last no this is a year and a half ago, and it was a post and it was talking about the DOE food truck that was in every borough, Brooklyn, the Bronx, and Manhattan, every borough of the city. I was like, is this a joke? Like, so you're just gonna forget Queens and Staten Island like they don't even exist? You know, Fought and with a lot of help from elected officials, uh, got that food truck to Staten Island for 2 weeks. 2 weeks. That food truck had more usage than the food truck in the Bronx. So wrap your head around that one. That the Staten Island DOE food truck had more traction and more usage than the Bronx one. That's obviously a huge need that whole individuals just didn't even recognize. So I think that's not making assumptions about Staten Islanders and what they need, which happens a lot, and not making assumptions about what you think people need, but recognizing and asking people what they actually really do need.
Now, that makes a lot of sense, and I think it applies universally, right? Like we cannot assume that we know what's best for people without asking them. Paloma, I'm going to ask you the next question around the gap between need and access. Like when it comes to benefits, housing placement, documentation, even coordination amongst multiple agencies. Where do you see that gap, and what would you think would actually improve like to close those gaps?
Well, kind of um, grabbing a little bit of what Heather was mentioning. I don't know if it's because we Staten Islanders are a little bit us against the world, and by the world meaning the rest of New York, but we have a really strong sense of community, and we rely on all of the other organizations to fill some of the gaps that we cannot fill. The problem is that we don't know exactly what every organization does or how they do it. We have sometimes a connection, we have a name, but we don't have the full picture. We do tend to, when we do know what other organizations do, we tend to send them clients, to connect clients with them. We don't gatekeep clients. And I think that's a great thing that speaks volumes about seeing clients as people deserving of respect, not just numbers that we need for our reports. Um, if we know that there's a place that can help them better, we're going to refer them there. We're going to try to connect them with more resources, more pantries. There's there's a site, the Staten Island Hunger Task Force, that has a list of every single pantry in Staten Island. And we have that posted in our pantry. So if we cannot serve them every day, which would be amazing, but it's impossible, they could actually go to different pantries every day of the week and get something. So I think that is the plus. The gaps that we need to fill is communicating better among each other, like knowing exactly who's doing what in real time, having some sort of centralized information desk, like a switchboard.
I just wanted to just piggyback on what Paloma just said. So this to me sort of like highlights the beauty of Staten Island. So the Staten Island Hunger Task Force that she mentioned. So Alex is the current vice chair. I'm the outgoing chair. Pretty much everybody on here is somehow involved with it. And I think it's pretty unique to New York City. I don't know of another task force like this. And basically, it brings together all the pantries under one ginormous umbrella to be able to collaborate with each other, talk about what their successes are. We have highlights. Paloma was a highlight of a pantry a couple of months ago. We highlight the wins that the pantries are having. But most importantly, we share with each other. We share successes, we share issues, we share challenges, and we talk about how we can, do better by Staten Islanders. So I think that's a model. And I think it is to be lauded and applauded in terms of how Staten Island pantries and hunger organizations work together.
I can second that. I think it's a wonderful collaboration, and it really does. You learn something new every time. I mean, at least our office learns something new every time that we go on because you guys are the ones that are boots on the ground. I think the last one I went to, you had a guest speaker talking about access for pet food for people who are experiencing homelessness or they're experiencing hunger and they can't even
Yes.
afford dog food. And it's so important that you guys are collaborating, and our office feels honored to be a part of the collaboration.
Intro 1172, Pet Food Pantry.
Thank you. That actually sounds like something that would be great to scale and have across multiple boroughs, and not keep it unique to Staten Island, because a task force like that, where it's having so much intentionality behind it, really can get more folks access to what they need. And I think that's, the thread of this whole conversation, right? Is getting the folks who need it at the time that they need it. Um, I do want to just let the folks in the audience know that we will open up for Q&A at 1:45. So I'm going to ask a few more questions in those next moments. I want to talk a little bit, now that we found out this great task force that is something that we should all want in our boroughs, is talking a little bit more about like policy and research. I think, Heather, I'm going to direct this question at you. Where do you see the well-intentioned policies falling short, and how could they be designed or changed to better support stability and dignity?
I'm smiling because my department is health policy and management at Columbia. So, I mean, this is what I think about on a daily basis. I mean, I think most policies fall short because they're well intentioned but poorly executed. I mean, I think about, like, for example, the soda ban from years ago, right? I mean, you could sort of see where that was going, kind of. It was like, oh, okay, that's sort of like a nice idea. And then it just sort of like went off the rails. So I think a lot of policies, they mean well, and people, and I mean, so if I put my legal hat on and you go back to legislative history of policies and you look at the intent, you could see where people were heading with it, but then it just sort of goes off the rails. So I think, a lot of policies that we see either like have poor implementation, they're not effective, they don't work well. It's not that, people were wanted to sort of like do be it's not that they wanted to not help people. They wanted to help people. But an effective policy has to be written really well. I mean, again, I'm not saying anything that Senator Scarcella-Spanton's office and Nina don't know, but it has to be written well. It has to be drafted well. It has to be well intentioned. It has to be implementable. It has to be able to actually happen. And I think a lot of policies, they really sort of fall off when it comes time to actually implement it and make it happen. it's really, really tough. And so that's why, not to plug the Staten Island Hunger Task Force again, but we do talk a lot about policies and what's working and what's not working. And so, I think having a space like that to be able to share uh, stories and to share experiences about, a hunger policy that may not be as effective as it could be, I think that that's helpful. But I think a lot of times policies are well-meaning, but just sort of, if they don't work, they can be poorly executed, or just they're not implementable. They just don't. They don't have the funding. They don't have the infrastructure to actually work, and that's what I spend my life force on, and it's what I spend my research on because a lot of the research that I do looks at uh, nutrition and hunger and how we get food to people and why it doesn't work out so well. So that's what I spend a lot of my time thinking about.
Yeah, and if I just wanted to jump in there and, you know, there were a couple things earlier that we're talking about policies and things like that. There are a couple policies that I did for I forgot to mention earlier that I want to make sure folks are aware of, and that's we're talking about SNAP, right, and how it can take so long to navigate that application process. One of the key things that was had funding roll back due to HR1 back at the beginning of July was the NOEP program, which is the Nutrition Outreach and Education Program. That's that funds a network of state SNAP navigators. As of right now, Hunger Solutions New York actually put out the ask, along with other anti-hunger organizations, pretty much everyone across the state, to fund NOEP at 8.5 million, and that's just to make up for that shortfall. And without navigators, you know, it's so much harder to navigate what is already an extremely difficult process with SNAP. Um, another really important piece there is WIC, which is a extremely effective, one of the most effective anti-poverty programs that really doesn't get its time in the limelight like it should. It stands for Women's, Infant, and Children, and it's literally feeding some of our most vulnerable people. But 93% of WIC agencies in a survey reported budget shortfalls and noticeable impacts on their operations, staff reductions, increased wait times. And the more that things happen, the more that those issues are exacerbated, the longer it will take to connect these people to the benefits, the longer the pantry lines get. All of these things are interconnected. And cyclical. There's about 200,000 New Yorkers that are eligible for WIC but still not participating, right? So that's a pretty sizable gap that we can as a state, I think, aim to be a leader. And also, and we're talking about SNAP a lot just to show the impact of SNAP. For every one meal a food pantry provides, SNAP provides 9 meals. So you're really talking, and not even to mention the return of investment. Each dollar of SNAP that's spent in a local community generates, by conservative estimates, $1.50, by other estimates up to $1.80 in economic activity. So Staten Island, for example, annually receives about $350 million in SNAP benefits, roughly, and that generates over $500 million of economic output. So you're talking about bolstering the local economy. It's not just free money, right? Like it keeps our local economy going, and there's nearly 700 SNAP retailers on Staten Island. And when you're talking about removing money from people off SNAP, you're literally talking about taking dollars out of people's pockets, food off their plate, money out of grocery stores' pockets. It's all very cyclical. That's one thing that we always try to really hammer away in our advocacy is you're investing in food systems, in the local economy. It creates jobs. Like it's not just freebies, right? So we're really trying to hammer away at the economic output that SNAP provides, as well as the humanitarian causes, right? And I mean, one meal compared to like 9, like it's the numbers are staggering when it comes to the impact of SNAP.
Thank you so much for that, Alex. I want to direct this last question at you, Dr. Rivera. With Alex talking about SNAP, can you share with how SNAP benefits directly correlate with homelessness?
Well, I think as a whole, food insecurity connects to homelessness, right? So, when you're operating tier 2 shelters, they have to provide their own food. Right? And so SNAP benefits are very beneficial that you're living in shelter so that you can provide food for your families. Those who live in commercial hotels, they do get food. However, they still get SNAP benefits because sometimes the food is not that good. And so they want to make sure that they can still eat. I wanted to highlight, though, the benefits of SNAP also allow for better quality of food, believe it or not, right? And people typically take that away, right? Processed in America, we eat a lot of processed food, which is not um, a worldwide phenomenon. That's just an American thing. However, processed food kills us faster. Everybody knows that, right? In plain English. So one of the things we look at is SNAP does allow you to get fresh groceries. It does allow you to keep your culture in your family dynamic while even though you're facing or currently being unhoused. And so all of those benefits that come with SNAP, it's not just they're gonna get food, right? There adds so many other layers to how they're able to survive. And then not to mention, this is relatable for everybody, but if anybody in here has ever been hangry, y'all know what I'm talking about? Imagine if you were hangry all the time, right? That would then produce a continuous cycle that you'll be in. You'll be more angry at your case manager. You'll be more angry at your partner. You'll be more angry at your kids. You'll be more angry, and all of that has that trickle down effect, and that's why it causes additional trauma. And so, HSNY, we try to make sure that we're not having our clients repeat said cycle, right? We want to try to break that cycle down to where if you can at least shop with dignity, get food with dignity, have access to food pantries with dignity, have community resources. Um, I'm loving the task force idea. I feel like I should go spark one in the Bronx. But I do know in New York City, there is something called Unite Us. I think it's a great app that allows us to connect with resources in the community. Both my youth programs and food pantry utilize them. But I think if that was a not worldwide, if that was a citywide initiative for all services, I think it would be a great central hub to connect us all. Um, and then lastly, I know you didn't, it's connected to SNAP benefits, but not really. It also connects to the system parts of it. And then I heard Alex mention the fact that a lot of people don't utilize like WIC and things of that nature. Going back to the bureaucracies that we also talked about, the level of questioning and coming back and get your kids and all these kind of steps that you have to take just to get SNAP benefits is remarkable, right? My mother had to do similar when I was a child. And I still think it's insane that almost 30 years later, there are still mothers that have to do the exact same thing. I remember my mother saying, and this is when there were books. I'm showing my age now. Y'all remember food stamp books, right? I thought they were Monopoly money coupons in the supermarket. However, even back then, my mother said that she used to just apply for emergency because she didn't feel like going through the system. She didn't feel like constantly having to come back, do an appointment, do those things. So I say all that to say that you have to be mindful of when you interact with our clients, it's not that simple. Like when we say just go to the food pantry and pick up food, it's not that simple, right? Or just go to pick up your SNAP benefits. It's really not that simple. That 7, 8 hour day that I tried to ask for food stamps and I finally got them. And now you want me to, it's a lot. And I want us to just all have a level of empathy and understanding for our clients, as well as our staff, because our staff are trying to get the clients to get said resources. And lastly, I just want to echo, I think Paloma said it, or maybe Heather, maybe we all kind of said it. I think that we all have to work together, right? Homelessness is not a new phenomenon. It's something that's always been around. And honestly, it's not something that can go away because you cannot control Mother Nature. However, it is something that we can, in fact, decrease to a more manageable level where we're only addressing FEMA and national and like natural disasters rather than creating cycles of poverty and creating more levels of barrier throughout our country and our city and state.
Marley, I just wanted to add to what Dr. Rivera said, that there's a component that we haven't spoke about, and it's mental health. Mental health is lacking in Staten Island, especially because we don't have enough trained professionals that are also bilingual or that can speak to clients in their own language. And that creates like a snowball effect. Somebody that's depressed, somebody that's not in the right mind is going to struggle even more trying to jump through hoops and go through the system to get what they need. They're going to wait until last minute when they cannot really apply and get what they need in time. It's going to create a lot of health issues down the line too.
Thank you so much for all of this wonderful and engaging conversation. And that is very true. We see it as we want to provide wraparound support. Mental health is definitely something that has to be addressed in that health portion of health and human services. You know, that is what we are all striving to do as we work together as a community to, as Dr. X said, we may not be able to end homelessness as long as we have national disasters and we can't control the weather, but we can end homelessness in the five boroughs from systemic and structural issues that we've all been facing. I know I said we were going to start Q&A about 7 minutes ago, but this conversation was so engaging, I didn't want to cut it short. But I do want to give folks a chance. If you have a question that you really want to ask one of our panelists, please do so in the public chat, and I will relay that question to them in our closing time here. Um, while we wait for questions to come in, I would like to get the panelists to think for a moment around if you could speak to the audience for what they can do as community members. What's one concrete action that a community member or another provider or a policymaker could do that would really make an impact on reducing homelessness in Staten Island in your borough? What would your call to action be to the folks on this call?
So I
You
would
said
have.
for okay.
I'm
Sorry.
sorry. I'm sorry, Dr. X. You want to go?
No, I was gonna say you said in regards to talking to community, like people who live in community.
The people who are, yes, who are on this call, the folks who are listening who are in Staten Island, like what is their call to action? What can they
Hmm.
do to support this cause?
Well, I'm gonna come from a clinical background. I'm gonna come from a place of empathy and community, right? I think that people have to understand that homelessness is a response to trauma already experienced, and it does not define who they are. And I think if we remove labels from people who are experiencing hardship and understand that we're all one paycheck away, or maybe one snowstorm, right? We're all one something away from being homeless. Try to be the person you need. God forbid you ended up in their situation. It's the same thing I tell my staff when I say to them, be the caseworker that you'll need if you ever ended up in shelter. So, as it relates to community, I think that people should look at it that way, right? Nobody's bigger and little. We're all in the same boat, and everybody should treat everybody fairly.
Yeah, I mean, I obviously agree with that wholeheartedly. Um, the other two things I would add would be a program Alex mentioned earlier, the 1115 waiver, which is like doing incredibly in Staten Island. Or SIPPS is our social care network, and it actually like helps with the unhoused. All the transportation, food security. You can get up to 21 meals a week through it. You can get transportation to get to appointments. You can get help with housing. If your housing is not great, you can get help with that. It's a demonstration project through Medicaid, meaning, Medicaid knows the bits it does well, and then Medicaid recognizes the bits it doesn't do well. And one thing that, Medicaid is trying to do better at is all these parts that happen long before you have a crisis, these sort of public health initiatives. And so I would say definitely learn more. Every borough has their own social care network and 1115 waiver. It's going to exist until March of 2027. Get involved, learn more. And the only other thing I would say would be talk to your local officials. Staten Island, we're very fortunate. We have great elected officials here. Senator Scarcella-Spanton's office is exquisitely helpful and willing to listen to people. You know, I they listen to me and what I have to say quite often. And so I think, you know, start to get to know your elected officials, have conversations with them. Even if it's not the area that they work in, they will vouch you to that. Her office and other electeds do a fabulous job on that. So get engaged, get involved, talk to your electeds, and learn more about programs like demonstration projects that the 1115 waiver is doing.
Thank you. I have one question from the chat that I would like to throw in here in the last 4 minutes. And that is from a system, this is from Mary Cuevas. From a systems and policy perspective, what concrete steps can shelters take to improve safety, dignity, and trust so that individuals experiencing street homelessness feel comfortable accepting shelter services?
I feel like that's for me. No, I cannot answer for I cannot answer for the city or governmental agencies. I can only answer from experience. I've been in the field now 16 years. One of the things about shelter is that some people outside of not wanting to follow rules, let's all call a spade a spade. Adults, we don't like rules. See, I need some people who are honest. Okay, thank you. Some of us don't. We don't like rules. So outside of that basic nuance, right? It's also a matter of safety, right? A lot of people who are street homeless are single adults. And because of that, if they go into shelter on the single side, for the most part, is dormitory style. And because it is dormitory style, that means that there cannot be cameras in those said living quarters. And so sometimes safety can be a major concern. And sometimes people rather take the risk, unfortunately, living on the street, or they feel safer living on the street. However, um, they have most recently, New York City implemented things called welcome centers and safe havens, which is much different than an intake facility. HSNY just so happens to operate the second welcome center in New York City. The idea of these low barrier facilities is that it allows the people who are currently living on the street to come in, feel safe. They get to meet with both medical staff, social workers, and other clinicians, and then we work with them to make a sound decision. And then we work with DHS to match them with the appropriate level of care rather than them just going straight into intake and then just getting plopped in a bed. And so that new system that the city has implemented, I think, is a valuable system because, again, it allows you to talk to the person, right? And say, talk to me about why you wanted to stay on the street. Why don't you feel safe? How can we assist you? What kind of support do you need? And then work with the city to make the adequate placement rather than a rapid placement, which is what our initial housing is, or initial intake is in New York City. So I hope I answered the question.
Thank you so much, Dr. Rivera. We are 2 minutes from closing, so I'm going to hand this back over to Jerry. I want to say thank you again to all of our panelists today and for the audience. This has been a really engaging conversation. I feel like we could go even longer, but I am going to pass this over to Jerry for our closing remarks. Thank you again to everyone for your participation today. Jerry, it's on you.
Going to echo Marley. Thank you to everybody. If we can put up the slide real quick, I really want to take the opportunity to thank Senator Spanton's office, Nina, JCC, Project Hospitality, Professor Heather Butts. You have been phenomenal. And of course, our very own Dr. Rivera. The stuff that's happening in the ground, I think it was said earlier, is not a one person or one problem issue. This really speaks to a collective bringing this together, and that's what these conversations are about. So again, we say thank you to you all. With that, I really want to highlight where conversations are going to continue to further. So here at HSNY, what we're going to do, or what we started to do, is we started to work on this podcast. This podcast is one step away. And so it's going to come up on your screen momentarily, and it speaks to, going back to Dr. Rivera's point, we are one snowstorm away, we could be one paycheck away. We are a majority of Americans nationwide are moments away from being in crisis. And so, how do we mitigate that? How do we stop that? Dr. Rivera is really leading that conversation. So when you get a chance, click on a YouTube. You can see the conversations that have started and the ones that are up and coming. Second to that, we're also having one of our amazing annual events called Scene. I would do it a disservice, but I'm gonna give a small highlight and I'll swing it over to Dr. Rivera to speak to it in more detail. The first thing that I would tell you is save the date. Save the date means June 25th. Lock it in your calendars. Tell all the people that you know you want to come to this event. This event really speaks to all of our marginalized individuals being seen in the space and work of and the advocacy of homelessness. Without that, I'll take a step back and I'll give it to Dr. Rivera to give you a bigger synopsis of it. But while that's happening, I want you to go into your inbox, your calendar, your phones, and start plugging in the date because you don't want to miss it. Dr. Rivera?
I mean, you did an excellent job. However, I just want to add the part that this is the third annual Scene Symposium. This year, we are focusing on reimagining affordable housing and development. This is a safe space, a collaborative space where we ask all practitioners, whether you're in your food and nutrition pantry, whether you're in the shelter population, whether you're an executive or a porter at one of them sites. This is where we come together. We have a great day. The beauty of the Scene Symposium, however, is that at the end of it, we do have collaborative solutions that every person should be able to take away and take back to their organizations because here at HSNY, we believe that if we share resources, then we can all end homelessness together. Thank you for that.
Thank you. And just to close us out, the very next thing that's going to come up is a QR code. When you get a chance, if you're looking at it via screen, please just take a screenshot. This is going to give you a link to all of the resources that we talked about, different events that are happening within HSNY. And what we also will do, also drop it in the chat, the resources that are shared through all of our community partners right now, as well as legislative officials for anything that is going on. So we take this opportunity while I'm speaking for you to scan the code to say thank you. Thank you to the panelists. Thank you to all the audience members that came in, saw, viewed, clicked, like, all the great things. But more importantly, thanking you for helping us being collectively a part of the solution to help tackle, I wouldn't say tackle, give a hug to this big problem that we can't do alone. So with that, we're all committed to ending homelessness and hunger to the best of our abilities. We appreciate you. Have a great day and prepare for the next snowstorm that's coming on Sunday. I think that's coming up next. With that being said, we appreciate you. Have a good day, all.
Thank you,
Thank
everyone.
you.